thank you all for coming to the session today to talk about Senate Bill 75 and several of the work groups that were commissioned by the state to investigate two of the kind of challenging intersegmental issues aimed at improving both the coordination and financing for Part C to B, as well as MediCal for students. Today's panel will focus on the latter of those issues, in particular on how the state, local agencies, affiliated partners are seeking to improve the coordination of those services, and in particular expand access for students' mental, behavioral, and physical benefit. And I'm joined today by a pretty stellar rockstar panel, humbled to get a chance to have a discussion with them. First, we've got Debbie Look. She's a principal consultant with the Assembly Education Committee. We've also got with us today Jillian Mongetta, who is one of the branch chiefs and does local financing at the Department of Healthcare Services for the state of California, and Stacey Wedin, who is an ed policy administrator within the Special Education Division for the California Department of Education. And so the way that we've set up the panel today, I'm going to create an opportunity for these individuals to kind of introduce themselves a bit more, and I'm going to pitch them a question that they can answer in their individual introductions. We're going to do a bit of discussion amongst the panel for a good segment of our little less than an hour with you today, and then we can take some questions and answers towards the end of our panel. So in the course of doing that, if you would like to ask some of those questions, please drop them in the chat. We've got our fabulous staff at Breaking Barriers that's going to help feed us some of those questions. So please let those flow away throughout the panel. But let's get started with you, Debbie. So as staff to the legislature, you were involved in the creation of this language for the bill. Can you talk a little bit about its motivation for the work and what assumptions you all had behind it?
Sure, be happy to. Thanks, Jason, and thanks to Breaking Barriers for having us. Pleased to be here today. Just want to start with saying, you know, we look at things from an education perspective, and we know that a child's ability to learn is severely hampered if they're in poor physical or health or suffering from mental illness. Members of the legislature have been particularly concerned with the mental health crisis facing students in our public schools. We know that 20% or 1 in 5 teens has or will have a serious mental illness. Over 30% of California teens report feelings of depression, and 10% have considered suicide. We know also that over 70% of children with behavioral health needs tend to receive no treatment at all, and those that do often receive that treatment at school. And we know that these mental health needs among our students have certainly intensified due to the stresses and social isolation associated with COVID crisis. We believe that schools are well positioned to provide health and mental health services to students, but lack the funding and personnel to do so effectively on a consistent statewide basis. Our schools have a woefully inadequate number of school nurses, school psychologists, school counselors, and social workers. Our state ranks among the lowest in the country in the ratio of these professionals to students. The legislature has been exploring ways to identify and enhance ongoing funding to support the provision of these critical services in schools for many years. We often hear from the field that existing programs, including the Local Education Agency Billing Option, or LEA BOP, which allows schools to bill for MediCal services provided to eligible students, has significant issues. People talk about the fact that the billing process is very complex, the audit process is lengthy, many claims are ultimately rejected, and schools feel they have a lack of access to training and technical assistance. As a result of these concerns and perhaps other issues, the number of LEAs or school districts and charters participating is low. Less than half of California school districts currently participate in the program. We've also been struck by the fact that California is drawing down significantly less funding in MediCal reimbursement for school-based services than most other states. The rate of perhaps it's estimated at $29 per child in California versus up to $500 in some states. Certainly there are differences in states, but just the magnitude of that is a startling factor. So the members of the legislature and administration believe there's a clear opportunity to enhance the provision of critically needed health and mental health services in our schools by accessing MediCal funding that more than 6 in 10 of our students are eligible for. These factors led the administration legislature to take joint action in the 2019 trailer bill, or SB75, to ask the Department of Education and the Department of Healthcare Services to bring together a working group of stakeholders to look at the coordination and access to federal programs, including the LEA BOP, the Administrative Program, or SMAW, as well as the early and periodic screening, diagnostic and treatment, or EPSDT benefit. The Assembly was particularly interested in ensuring that the work group consider how best to access the EPSDT benefits that so many of our students are entitled to. So overall, we wanted to learn what actions the state can take to ensure the ease of use and access to these funding sources for LEAs throughout the state. And we also wanted to know whether there are barriers in place that can be addressed through state legislative action or regulatory changes. Pop it back to you, Jason. You're muted, Jason.
Yeah, thank you so much. And I think, Debbie, that many of the challenges that you've outlined, I think many of our practitioners in the audience in our K-12 schools, from healthcare organizations or other partners, can certainly reflect on many of those challenges that we're facing in the state of California. And so I want to turn to you, Jillian. You are with DHCS. You run 2 of the 3 programs that Debbie has mentioned that the legislature and the administration has been looking to investigate and how to improve. And so hoping that you might be able to kind of speak a bit to kind of how you've entered this effort, maybe a little bit about your background and the perspective you have on providing these kinds of support to our schools in California.
Yeah, good morning. Thank you, Jason. So really, we started this effort very excited. We were excited to have a real focused attention on a relationship between DHCS and CDE. As we know, sometimes we can get siloed in not only, each of our departments are so big, so not only within our own departments, but of course then with other departments as well. And so this effort really brought us together in a way that we've never had before. And so we really wanted to work really closely with CDE, and this was a perfect opportunity. So we came in very excited, and it's been very fruitful so far. The relationships that we've created with CDE has helped both us and CDE kind of understand each other a little bit better, understand the cultural norms, understand the different vocabularies, the different levels of priorities, and different cultural things at each department. And so it's been a really positive experience because both departments have an extreme interest in providing the best healthcare and the best education and the best experience for children, whether it be at the school site or wherever they are. And so the relationships that we've built with CDE, we're now, it's not uncommon for us to just email each other about different policies or ideas, even texting, picking up the phone about, hey, what are your thoughts on this? Or, hey, can you, give me some information on the school-based funding on this? And Stacey and I are kind of like in lockstep, and her team. And so it's been a really positive effort so far, and we're really excited to continue the work here.
Great, thanks, Jillian, so much. And I think your points about, in particular, the kind of difference in cultures, I think has been a really kind of early learning for us. As a support organization at WestEd, the staff and I that have been supporting both you, Jillian, at DHCS, and Stacey and the team at CD, I think can absolutely recognize and hold up the importance of even some of those initial understandings of, getting on the same page about vocabulary, getting on the same page around priorities and principles for the work towards the mission of really what Debbie outlined as the legislature and the administration were coming together around this issue. So Stacey, you're at the Department of Education working in the special education division, and was wondering if you could kind of pick up maybe where Jillian left off in speaking about how these two segments, substantial segments of childcare serving agencies, education and healthcare, are coming together in ways that perhaps you've seen before, or maybe you haven't seen before.
Yeah, thank you, Jason, and happy to be here. Hello to everyone in the virtual space. Sorry I can't see you, but I'm happy to be having this discussion. So, Jillian made a lot of good points. And, for my background, I've been with the Special Education Division for 10 years. Prior to that, I was actually at the Department of Mental Health, administering the AB 3632 program. I know that term will resonate with a lot of the folks in the virtual audience. I'm a social worker by trade, so I've sort of lived in this space for a long time, and we've been circling around this same conversation for many years. And Debbie did a really good job sort of highlighting the importance. The importance really can't be overstated as far as the connection and the nexus between education and health. So from an education standpoint, as Debbie stated, we know that children, they can't learn unless they are well. So you can have the best curriculum and instruction, you can have the best teachers, you can have the best MTSS framework, all of it can be in place, inclusive practices. But if you're building on a cracked foundation, it risks just falling apart, right? So students come to school, they carry with them what happened that morning, what happened the night before. So we know the significance of mental health and wellness overall for our students to be able to succeed and learn. So, it can't be overstated. And that's why this work is so important. Part of that is, as Jillian was saying, is creating these relationships so that we can have the conversations necessary to make sure that our systems are set up to reflect that priority and to support that notion. So I think, we've been having this conversation for many years. We've tried it different ways. We had 3632, we had 114, responsibilities have shifted. I think there's agreement across the board that we can do better in the state. And so you see that commitment, and it's certainly been, reiterated throughout this project. And we entered into the project very excited. It's bigger than special education. And that's a really important point. This initiative, this look at how to maximize Medicaid revenue to get services to our students in schools is bigger than special education, but a lot of the times the conversation is a little bit easier when you're talking about special education because of the IEP and the natural sort of connections and overlap there. But it is bigger than special education. However, we in our division were happy to sort of take it on and lead the effort. Again, because we know how important it is, and the implications are big for the state and for our students ultimately. So very excited. And as Jillian said, we've established a really great connection, and the work has just begun, really. I mean, these conversations are early, and it's very complex. So we'll continue to push along.
Yeah, thanks, Stacey, so much. And one of my kind of reflections on kind of the opening here from the three of you is really about the necessary sets of structures that allow you all to talk in a more fluid way about how these structures, be it policy or implementation of these reimbursement programs, or by extension potentially into EPSDT, are showing up in local communities. And I think a lot of what I've observed in the exchange between the state agencies and with the work group is it's creating firmer connection in opportunities to, I think, really model for other parts of the state that aren't currently doing this, what this might look like in the future and how to go about doing that. And so I want to dive into a bit of the kind of back and forth, for those that are joining us virtually today. We can't see you, so we're really just having a bit of a fireside chat, which I appreciate. I don't get a lot of this time with Debbie and Stacey and Jillian. It's often very much about the work. But I want to start with you, Debbie. As Stacey and Jillian were initiating, we've kind of just started on this path. Part of our deliverable to the legislature and to the Department of Finance went in the form of a progress report that you all received now just about a month and a half ago. And I'm hoping just to kind of crack into some of the substance about this issue, having submitted that initial progress report, reflecting on your aims in initiating this work, what were the major, a handful of items that kind of stuck out to you?
Sure. Yeah, we were really happy to see the initial discussion, and we think, the discussion so far with both the departments, but particularly with all of the stakeholders involved, all of the people at the schools that are coming forward and really laying out the important issues that they're facing. So some of the things that kind of really jumped out at me was one being the recent state plan amendment to the Medicaid plan that allows schools to bill MediCal for services provided to all students, not just those with an IEP or individual education plan. We think opens up a tremendous opportunity to increase the scope and level of school-based health services. So really excited about that opportunity. We know that, I think that the report laid clear the fact that we need to build capacity at the state level to provide support and technical assistance to local education agencies in accessing these funding streams. And this will likely require additional staff at one or both agencies to support these efforts and to facilitate that ongoing increased communication and collaboration that Jillian and Stacey both highlighted. That we're really pleased to see that and want to make sure that that is an ongoing kind of practice that helps to support people at the local level. I was also struck by the importance and discussion around incentivizing partnerships at the local level between schools, county agencies, managed care plans, and community-based organizations, so that we look at how we best leverage the broad range of support available to children and youth, and to know that school by itself can't do this work, but by leveraging all that's available in communities. And then finally, just in addition to continuing to look at how do we improve the LEA BOP and SMA programs, we're particularly interested in exploring the opportunity to ensure that we're maximizing access to EPSDT benefits, again, which I mentioned earlier, that our children are entitled to. So those were kind of the takeaways that kind of jumped out at me from the initial report.
Thanks, Debbie. I want to invite Jillian and Stacey. Any kind of reactions to that? Any elements you would want to underscore or kind of add a bit more detail to some of the stuff coming out of that initial progress report?
Yeah, I think Debbie really, highlighted a lot of the same things that really stuck out to me. One of them being, the partnerships and how we can connect the LEAs with the counties and with the managed care plans, and just the importance of that for a holistic level of care for the children. Another thing that really stood out for this project was really just the more we got into the project, the more we were trying to really figure out what was going on and how we were going to identify and these barriers and also find solutions for these barriers. Really, the more intricacies we developed and the more nuances to school-based healthcare really came about. And so I don't think that any of us really knew just how complex and how nuanced this nexus is between education and healthcare really is. And so that has certainly been a bit surprising. And it's been something that we've kind of talked about along the way. And I think, to that end, I do think that there is a lot of work to be done in this space. And I'm hoping that SB75 is really just the beginning of it.
Great, Jillian. Stacey, anything to add there?
Yeah, I echo what both of my my fellow panelists have said. It's the complexity continues. I mentioned before that I've kind of lived and in this space for quite a while, and yet the level of complexity is still sort of stunning. It's like untangling a ball of yarn. You start pulling on one thing, and you're like, oh, so then I need to talk to these people and ask these questions, and so it's very complex. That also can't be overstated. But one of the things that stuck out to me in the report was, or actually not in the report, it was about the work itself. The level of commitment that we saw with the work group and the people that came to the table to have these discussions was really just impressive and sort of inspiring for me. We have so many people in the work group that have, very busy people that have contributed their time and expertise. And so it just demonstrates how important this work is, and just the broad recognition of and commitment to making it better in the state. So that really stood out to me. It's been really sort of inspiring to be part of it.
Great, thanks so much, Stacey. So Jillian, I want to move to you just to kind of kick off, get into our next discussion, kind of to focus really on this collaboration. I think you can see me kind of looking over to the side. I'm monitoring the chat as questions continue to roll in here. And actually one of them that I think is very relevant, to this question I'll put to you, Jillian, we had from Rachel that asks, how do specific school districts build relationships with mental health resources in their county? And I want to parallel that, right? So Jillian, you were speaking at your opening about the experience of establishing these relationships with folks over in the Department of Education. I think a lot of those principles might be directly parallel to the way that local education agencies are thinking about partnering with either governmental or non-governmental mental health, physical health resources in their local communities. So can you speak to, like, if somebody said to you, hey, what are the top 2 or the top 3 things that I should be thinking about as I try to establish this partnership across, to another child serving agency? What would you say to them?
I would say that it's really important to, I guess, really like take ownership in the process of developing the relationship. And so reaching out to different people, even if you think that there may or may not be like a real overlap, because sometimes, like with CDE, once you get into it, you kind of start unraveling and start seeing and understanding the culture better, and start understanding the questions and start asking different questions. And so really one would just be to really own the process of going out and learning about the different agencies and owning the process of building that relationship. And then the second thing is really, I think, sometimes different departments or different groups, an LEA, maybe a county mental health plan or a managed care plan, they each have their own philosophies or mission or values. And I think the biggest thing to remember is that the end user is the child, and we are here ultimately to ensure that the children in the state of California have the healthcare that they need. And so putting all differences aside and just focusing on that one piece, I think is really essential, because you can get kind of, it's easy to get kind of pulled away with some of the differences you might have, or, whether it be politics or policies or, different types of leadership or whatever. But at the end of the day, and I think that this is something that we've had with CDE, it's like, look, at the end of the day, we are on the same team, and the number one thing that we care about is the care of children, and everything else just needs to be put aside. So I would say that those 2 things have really been helpful, and I think can be helpful in building any relationship to better improve the care that children are receiving.
No, that's great, Jillian. I might have heard a subtle mic drop there, but that was great. No, I really appreciate that. Debbie, Stacey, any other reflections on what Jillian was offering there?
Yeah, I'll jump.
Oh, go ahead, Debbie.
Or go ahead. Okay. I think that as Jillian mentioned, and others have talked about the fact that people speak different languages. So how do we come to the table, or how do we know who to talk to? And so I think it's just a matter of really reaching out, and sometimes, one side expresses interest in working with the other, but doesn't know who to reach out to. So I think just kind of making those efforts to find those people with common ground and common interests, and having those difficult conversations. And I know people like in Placer County, they've talked about the fact that education and other child serving agencies get together, and they have kind of learning sessions of, here, I want to teach you my language this week, about, to understand what it is, why we do what we do, and how we do it, and how we can find those intersections. So I think those kinds of efforts to reach out and find those people who are interested in making those connections, and supporting and encouraging them.
Yeah, and I would add, you have to sort of relentlessly pursue the conversation. So even if you don't know who to call, just send an email. Start with, the public health director, reach out to the behavioral health director. You just start with an email and a conversation, because it is so important. And then I would also say, just be very open and curious. And I've seen that from both sides, you know, from me and from Jillian and from our staff. Just questioning, asking questions, learning, because it will be sort of an exercise in learning. And most of the people that are listening to this session have already know this, but just being really open, thinking outside of the box, understanding that there's a lot to learn in this space on both sides of the house. And so, you know, establishing those common objectives, but then being sort of curious learners as you go along.
Yeah, no, I think those are tremendous. Somebody should make a one-page flyer out of what you all just said on that topic for sure. That was great. I really appreciate that. So I'm gonna, you know, I've been a little bit soft. You call them softball questions up to this point. So I'm gonna throw a hard one at you guys. So, and Stacey, we're gonna start with you on this one. So the Department of Education has basically been sponsoring this work. I think, you know, a lot of the, you know, practitioners, I would count myself among those, having spent 10 years in school districts as a chief financial officer, would say, you know, this is all well and good, but it's not really going to affect what I'm doing on a day-to-day basis. It's not going to affect, you know, the students that we're trying to serve in our school system. It's not going to affect, you know, the children that we are serving, you know, through our through mental or physical health service provisions. So how do you guys respond to that? How do you respond to that, Stacey, in saying like how this work is actually going to get down to the ground level to get back to what Jillian was saying about the end user, about the child, that will ultimately be able to impact them?
Right. I would say I get it. You know, it is, you know, my friends and my family, even, they say, what do you do there at the state? Like, what you know, what you just, you know, so I get it. I get that there, you know, it's a long ways when you're looking at, you know, state level policy and state level collaboration versus a student going to school and how that's going to benefit that student and their families. So I have an example. And first, you know, I just want to say that I think it's super important. I think everybody would agree that, you know, when we're talking about, when we are preaching to our local educational agencies or our managed care plans about good collaboration and building relationships, if we don't model that at the state level, then you know, we have kind of an issue. So first and foremost, we as the state agencies need to model that. We need to set the example, and we need to provide a roadmap to the extent that we can in how to build those relationships. And that's been, you know, part of our effort so far with SB75. So that's first and foremost. Secondly, I do have an example that I like to share. And this is a real example. This is something that came across my desk a couple months ago. And it was some of our partners at Healthcare Services. It wasn't Jillian, but if somebody else at Healthcare Services was asking the question of CDE, they said that a managed care plan had denied an insurance claim for a student that was being served by a residential treatment facility because the residential treatment facility wasn't offering, quote, accredited educational services. So the question came over to us, well, what is that? What is accredited educational services? And in our space, that could mean a lot of different things. And so then it became an exercise of, well, I don't know. What is the managed care plan using for that definition? What are they seeing as accredited educational services? Does it match up with what we would consider to be accredited educational services? Are they talking about non-public school certification? What is that? And then is it an appropriate basis to reject an insurance claim? So right there you have, you know, a student receiving services, an insurance claim that comes through, and a term that may mean different things to different agencies. So being able to have those kind of conversations and having them feel like they can reach out to us at CDE and say, do you know what this is? You know, does this make sense to you? Is super important, because that's where the policy is set, right? So then we're going to go back to that managed care plan and say, that doesn't make sense, or that's not appropriate, or here's what this really means. So examples like that happen all the time. And I know that, you know, people don't readily see that, but it is very, very important to have those conversations and have the infrastructure there to be able to have those conversations at the state level, you know, because it does directly impact students at the end of the day.
Yeah, no, one thing I can appreciate about that very specific example, Stacey, and I want to maybe broaden some of these principles and then bring Debbie and Jillian in here, is that, you know, we talk about government as being a bureaucracy. I think it's often gotten this label of being a very bad thing. But in some ways, when you set up the system well, when you set up government and delivery of public service, bureaucracy simply means the ability to be able to operate the same thing consistently over and over and over again. And part of what I'm hearing you say is that that in this circumstance, it's a question of regulation, it's a question of clarification about the policy or their interpretation of the policy. And so that as you all are seeking to do this work, you're really trying to kind of cut through that burden, right, for practitioners. So say the next time that question comes up, instead of it taking 2 weeks to answer, you have an answer, it's consistent, you have partners across agencies that know the answer, you provide the answer and then you move on, right? And that level of consistency and being able to get better, again, kind of end in mind, like how do you ensure you're getting effective and efficient services to the child, is really part of what you guys are trying to chip away at, what I'm hearing from what you're offering, in a pretty substantive way, which I think is great. But Debbie, Jillian, other perspectives that you would add to the question I posed to Stacey?
Yeah, I can jump in here.
Yeah.
Definitely agree with, you know, what Stacey said in that, you know, we here at the state, we need to model the way in how to build and maintain professional, well-working relationships, and that's what we're doing here. And then also, you know, the goal is to really build that roadmap. So, you know, we have all these different levels of government, and the money is here at the federal level. And then we have the state, and then we have, you know, the counties, and we have the cities, and we have the LEAs. And so, as we all know, California is very diverse, and each city and county and LEA is different, has a different population, serves different people. And so we do want the LEAs to be able to have, you know, local control. We're a local control state, right? And so how is it that we can, you know, improve if the state is in between the federal and then the local level? How can we here at the state become like a vessel of information flowing and kind of stand on behalf of the children, really, in the state of California? And so really that's our goal, and that's our mission. And so what we're doing here with SB75 is definitely, you know, partnering with the stakeholders and with the different LEAs to, okay, how do we build this out? How do we build out this roadmap? So when people say, how do I even develop these relationships with these counties? I don't even know who to go to. We can have that built out, and we can encourage that and also model that, and then really expect that, and expect that the LEAs are, you know, moving in this direction of collaboration, because at the end of the day, we know that their concern is the child as well. And so that's kind of how I would say that. Debbie, I don't know if you wanted to join in on that.
Yeah, I mean, I very much echo what both my colleagues have stated, and I think we're all kind of on the same page and going in the same direction here. I think it's really clear, and has come out of the work of the work group so far, and things we've been hearing for years, is that the local education agencies feel that they need both consistent and accessible support and technical assistance from the state, so that when they want to enter these kinds of programs or expand services to students, they feel that they have someone they can turn to for those kind of consistent and clear directions. I think we need to deal, and we, you know, as I've been identified in the interim report so far, we need to deal with things like the audit issues, so that the LEAs have some support in submitting their claims that are maybe more likely to be reimbursed on a consistent basis, so they can count on that funding and budget for it, so that they know that the you know, provision of health services to students isn't going to negatively impact their overall budget, that they can count on kind of a substantial source of funding. And, you know, so that we look at that in a more supportive way. How can we support schools and districts rather than what some of them see as a kind of a punitive approach? And then finally, as Jillian also said again, we need to have that interagency conversations and collaboration at the local level to leverage all of the capacity and funding that's available from multiple sources to meet the needs of students. And again, we need to model that at the state level, but we need to also, encourage, incentivize, find ways to make those connections at the local level.
No, that's great. So I just want to transition. We've got a numerous set of questions in the chat, so I'm trying to be judicious in what I select. I think the two things that I want to circle around, and this kind of picks up on some of these points that we've been talking about, but in particular on the reimbursement program side, so the LEA BOP and the ESMA, two of the biggest hurdles that we've heard through the work group have been around the paperwork to make the claim, right? So to actually receive the reimbursement, and it's substantially increased amount of burden as compared to other sources of K-12 funding, for example. And then the matter around audits, and in particular, the length of time to get to the audit, and then what happens in going through that process itself. And so I want to put it to the three of you. I'm kind of open, whoever wants to kind of jump in initially, but how you've been hearing that come up with the work group, what you see the path is moving to the final report in October of next year, that might help to address two of those often cited issues and concerns with that part of these programs.
Yeah, so this is Jillian. I can kind of start the conversation. I think, we do hear a lot from the LEAs. They struggle with the documentation and the audits. And I think that's really where the people in education are experts and SMEs, subject matter experts in education, and they are not subject matter experts in healthcare. And as we know, healthcare is very dynamic and very complex, and MediCal is very dynamic and very complex. And so, there's an inherent barrier there. We're asking education folks to jump into this healthcare world. And so I think that a way of mitigating that really is through the partnerships with the managed care plans, with the county mental health plans, with these other entities that know how to build, who have healthcare expertise and understanding. I think that is going to be a big game changer for the LEAs if they start to partner with and lean on their healthcare partners. So I think that's really the biggest thing, and we understand that there is a challenge there. But in order to receive federal dollars, there are federal rules and laws that must be followed, and so we understand that that's burdensome. But that is how the system is set up at the federal level, and so I think there's no way around those federal laws for federal dollars. But what we can do is help the LEAs get support, and instead of billing us directly, working with these other agencies.
Great, Jillian. Stacey, Debbie, you want to jump in on that one?
I just wanted to jump in a couple of things and very much agree that this is such a difficult process, and we know that certain large school districts like Los Angeles Unified is sufficiently large that they can have staff who are experts in medical billing and are able to do this function internally. Other places, Monterey County, I'm aware of, where the behavioral health department actually provides the services in schools, I believe, and handles the billing process, as Jillian was talking about, having an agency that has that expertise to do it. So I think, again, as we've talked before, that California is so different. School districts from one to another are so different that, there won't be a single solution that meets all the needs, that we need to look at a variety of solutions that can work in different communities, and depending on who the players are and how things work best, that we need to recognize that there are those differences and we need to provide different solutions.
Yeah, and I'll just add, a couple things with this discussion. If we recognize that schools are sort of uniquely poised to be this center of wellness, and so how do we pivot the system to support that and to give them the tools that they need to to act in that capacity without them becoming sort of a healthcare agency fundamentally. And that's really difficult to think through. And then, as far as audits, we've received, quite a bit of feedback from the work group about the audits. And so I think it's just, and everyone's invested in this conversation, it is really determining what is driven, what are non-negotiables, what's driven by federal law, what do we have to do, and then what's the best, is there any area where we can improve, like provision of technical assistance? And then just determining what works for your community, as Debbie was saying, are you large enough to sort of take on or build out a little bit of infrastructure? It goes back to one of the findings in the interim report around, LEAs needing to feel, local educational agencies needing to feel like this is worth their time and investment, that they're actually going to get, some bang for their buck. So if they put out this money up front, and they hire some, billing sort of staff or whatever that looks like, that eventually it's going to be fruitful. And I don't know, I think that we need to build some confidence in that regard as we move along, obviously, because we've had a lot of feedback that maybe they don't feel that that's a viable option at this point. So, lots of areas where we can sort of dig in and do better.
No, that's great. So I want to hit one of the other things that I think is readily tied to how some local communities have been getting over some of those barriers. I think in particular, calling out this idea, as you said, Stacey, that schools are the hub, but they don't necessarily have to hold all the expertise. They need to, though, think about how to effectively create and build partnerships. And those other agencies need to think about how they can build partnerships with their local schools in order to create that viable hub that exists where, we have students, in obviously a non-pandemic year, are on those campuses on a routine basis. So one question I want to hit, and then I want to move to close to talk a bit about concrete next steps and kind of where you would encourage folks to be leaning in on this issue. And so as you've gone through this process, think about the one location in California that you've seen in and around these issues that you would point out as an exemplar, or a thing that's been really fascinating to you, that you think like, hey, they obviously have something going on here that that we want to look a little bit closer at. And so across your experience on this, just quick hit, where is that location? And then maybe a couple of seconds about why. Stacey, we'll start with you.
So I would say, Desert Mountain SELPA is obviously lifted up as an example in a lot of these conversations. So that's one place to look. But I will also say that there are Sacramento County and Placer County are also doing some really wonderful things with some MHSA funds and building out sort of those cross. I know Sacramento County is putting clinicians in schools, and Placer County has also navigated this tricky area of hiring on mental health clinicians in the education context. So I would also sort of lift that up as maybe, giving them a call and seeing what's happening there.
Great. Stacey, thanks, Stacey. Jillian, what about you?
Yeah, I mean, I would say that, the same counties that that Stacey talked about, specifically the new work that Sacramento County is doing. And we do know that, as I talked about before, California is so diverse, and we do know that, some of the bigger metropolitan counties that maybe have more resources and more funding and more dollars available to them are really, kind of doing a little bit better in this area. And so we do realize, from a state perspective, from a healthcare perspective, I think on every level, education as well, is, how do we support the counties and the LEAs in the more rural areas who really might have some financial constraints and some just a lot of different barriers, even just distance barriers and the number of people available to take in to bring on as physicians. And so, I mean, that's something that we're really thinking about too. I think that we see some of these counties just doing a lot of great things, and then we see some of the other counties really struggling. And so how can we here at the state help and support some of the smaller and more rural counties?
Great, thanks, Jillian. Anything else to add there, Debbie?
Yeah, I think Stacey pointed out the ones that popped to the top of my mind as well. I would just add, maybe as I mentioned earlier, Monterey County, the work that they're doing with behavioral health, connecting with schools, and also maybe Alameda County, who's had a great experience of building out school-based health centers in a large number of schools in their district, particularly in those low and disadvantaged areas. But I would very much agree with Jillian about the need to look at those rural, remote areas. And I think things like we're looking at, particularly through COVID, the use of telehealth for services to schools that I think is proving very successful, particularly mental health supports, and that, you know, potentially looking at opportunities to expand that beyond COVID because of the value of that in perhaps reaching some of those rural, remote communities.
Great, thanks, Debbie. So let's go to close. We got about 4 minutes left. Here's what I would say about concrete next steps to our audience. Number one, probably read the progress report. I posted it in the chat so you can take a perusal through it. You know, CD did a great job in kind of layering it, right? So summary up front, here are the big major findings in the report. If you want the detail, the data, the research, the charts, all that stuff is listed in the back. Good bedtime reading for anybody interested in this topic. So for the three of you, concretely, what would you say to anybody in the audience today is a step that they could take to lean in further on this issue, even as the state is working its way towards, you know, this final report that'll be due to the legislature and DOF in October of next year? And we'll start with Jillian.
Okay, thanks, Jason. So I would just say that as far as a way, you know, of really leaning in is, like I talked about before, is really the two things of establishing relationships with the other people in your community, the other agencies in your community is going to be vital for everybody at every level. And then the second thing really is in all of that, in those relationship building and in all of it, just to continue to remember that, you know, we are all on the same team and that our goal is to provide the best services for children. And so, you know, really encourage people to not get separated by the differences and really just focus on what we have in common here.
Great. Stacey, we'll move to you.
Really quickly, because I know we're running out of time. I would say, you know, from an education perspective, local educational agencies do a little self-assessment, you know, and ask yourself, you know, what's our population? Do we have a high population of MediCal beneficiaries? Are we billing MediCal? Are we participating in the LEA BOT program? You know, just do a little self-assessment and then start having conversations, reaching out and saying, can we do better? Can we do more? What else is out there? And reach out to the state. If there's something that you know that we're missing, reach out because we want to know at this point.
Great, thanks, Stacey. And Debbie, we'll give you the last word on this topic.
Yeah, and I think I would just encourage people to, as Stacey, just building on Stacey's point of, let us know. I think this SB75 process is providing us a unique opportunity for us at the state level to hear about those challenges and barriers in providing these healthcare services. We want to hear from the field so that we can figure out if there are things to do that we can fix at the state level and that we can advocate for at the federal level if necessary, so that in the end we reach the goal that we're all trying to do of promoting both mental and physical wellness for all of our students.
Great. So I just, in closing, really want to appreciate Stacey, Jillian, and Debbie, you guys taking the hour out today to really unpack, really just even at the surface, this topic that, as you all kind of reflected on, is very complex and complicated, but an absolute necessity for the wellness and thriving of our students in California. And to our audience, thank you so much for joining today. Really appreciate you chiming in over chat. And I will absolutely echo the sentiment of this entire panel that we do want to hear from those local communities, things that you're trying, things that you're attempting in really bringing together these two child-serving strands of our work in California. And I think with that, I'm going to turn it over to Richard to let him transition you all. Richard?
Thanks so much, Jason, Debbie, Jillian, and Stacey for your wisdom and championing this much needed reform work in California. Please join with us by clicking on the next link where we'll hear from our KC Family Programs champions and voices from the field about transformational experiences led by youth and others. Thanks very much.